Okay, well, it is just a few minutes after 12, so we will, in the interest of time, go ahead and get started. And I know people will continue to join us. As you heard and acknowledged, I just want to let everybody know that this session is being recorded. All on target seminars are recorded and then later posted to the UConn Arms website. In addition, just to let everybody know, today we are honored to be joined by CTN, which is the Connecticut Network. And so welcome to our friends at CTN. And so it's like being double recorded. Lots of places to find this webinar later. So let me go ahead and get started. My name is Carrie Racian. I am a senior research scientist at the Yale School of Public Health and the executive director of Yale's Firearm Injury Prevention Team. UConn Arms and the Yale School of Public Health jointly host this seminar on target once a month to provide an opportunity for dissemination and discussion of emerging firearm injury prevention work. This seminar is open to all researchers, policymakers, practitioners. Frankly, anyone who wants to learn more about this field and this work is very welcome to join us here, and we hope that you find it useful and come back. If you would like to present at On Target, again, we also welcome all forms of research, quantitative, qualitative, very polished, very emerging. So from postdocs all the way up to senior faculty members, everyone is welcome as long as your research uses rigorous methods. We are delighted to host you here. Please let us know. I'll pop in the chat who you need to email if you're interested in presenting. Our next seminar will host Margaret Kelly, who is the author of A Gun of Her Own. That will be on June 17th. I will also post into the chat the RSVP if you would like to join us for that, and I hope you will. But today, while you're all here, I am excited to welcome both Katrina Nelson and Mary Vriniotis from the Yale School of Public Health. They are going to present work on Guardians for Health, a youth firearm injury bystander intervention. Just so everyone knows, the format for today is that Mary and Katrina will present for roughly 30 to 35 minutes, and then we'll open up the floor for Q&A, which can be about anything from technical methods to how something's been received to next steps, you name it. Any question is welcome so long as it is respectful. Please make sure that you are muted for the presentation, and please help me in joining both Katrina and Mary to On Target. Guys, the floor is yours.
Thanks so much, Carrie, for the introduction, and welcome everyone. I'm excited to be talking with you today. I'm Mary Vriniotis about the work that we've been doing for the last 5 years on Guardians for Health, which we call G4H for short, for the Guardians for Health Bystander Intervention Workshop for Firearm Injury Prevention. I want to start off with a quick shout out to our funders, especially to CDC for funding the bulk of this work to date, and then to a Fund for Safer Future and the Roundhouse Foundation for helping us keep this work going. So we know that not only is firearm injury a leading cause of death for American youth, but there are similar death rates in rural and urban communities. We know that firearm injury is preceded by identifiable and modifiable risk factors. And in spite of this, evidence-based interventions that are acceptable to, let alone designed with, the firearm owning community is limited. And this is also in spite of the fact that more than a third of American youth live in a home with a firearm. So our principal investigator, Dr. Megan Ranney, who, as some of you know, is the dean of the Yale School of Public Health. A few years ago, she was at Brown University, and when she was there, she was seeking the right community partner to work with to reduce firearm injury in the US. And as an ER doc, she is a co-founder of the American Foundation for Firearm Injury Reduction in Medicine, or AFIRM, at the Aspen Institute for short. And it just so happens that her co-founder, Dr. Chris Barsati, was not only an ER doc, but a 4-H shooting sports instructor in his home state of Vermont. So he reached out to Dr. Todd Kessner, who at the time was chairing the National 4-H Shooting Sports Committee, and the seeds of Guardians for Health were sown. As Guardians for Health is a collaboration with 4-H, I just want to provide a short introduction to land-grant universities and the 4-H organization. So the land-grant university system began way back in 1862 with the mission of teaching practical agriculture, science, military science, and engineering via state universities. And now today we have 106 land-grant universities around the country. 4-H was formed in 1914 when Congress created what's called the Cooperative Extension Service under the USDA to support and deliver community education programs in rural areas. It was created in response to increasing urbanization in the early 1900s, which led to social and cultural shifts in rural America. Young people were increasingly uninterested in pursuing farming as a profession, so 4-H was developed as a way to re-engage rural youth with agriculture. And it sought to provide young people with a sense of purpose and pride in rural life, while also preparing them to embrace modern science and technology in the farming process. One piece of 4-H history that I found fascinating to discover was that during this time, researchers at the land-grant universities and the USDA saw that adults in the farming community did not readily accept new agricultural discoveries. But the educators found that youth would experiment with these new ideas and then share their experiences and successes with their families. So as a result, rural youth programs became a way to introduce new science, new agricultural technology to the adults in the community. Today, 4-H is the largest youth development organization in the country with over 6 million members. It has expanded its purpose to provide educational opportunities for youth related not only to agriculture, but also to STEM, healthy living, and particularly civic engagement. I'm going to bring that term up again shortly. The name 4-H refers to the organization's focus on developing four key personal qualities among youth: their head, their heart, their hands, and their health. The mission of 4-H is to provide meaningful opportunities for all youth and adults to work together to create sustainable community change. So you can see how this was a great framework for us to work with them on the issue of firearm injury in America. Specifically, they have a discipline, 4-H shooting sports, which was established in around 1980. And the goals of shooting sports are to enhance the physical, cognitive, social, and emotional development of youth through safe, educational, and acceptable involvement in a shooting-related activity. As part of that, they teach, of course, safe and responsible use of firearms, and archery is also part of shooting sports. They serve up to 450,000 youth per year, ranging in age from 8 to 18. And within shooting sports, there are 7 sub areas that one can focus on: rifle, shotgun, archery, I mentioned, muzzle loading, pistol, hunting and outdoor skills, and Western heritage. So our what centers around something I know many of you will be familiar with called the bystander effect. This is a social psychological theory that states that individuals are less likely to offer help to a victim in the presence of other people. It was first demonstrated in the lab by Doctors John Darley and Biv Latane a few years after the murder of Kitty Genovese in New York City in 1964. In 69, Latane and Judith Rodin staged an experiment around a woman in distress, where subjects were either alone, they were with a friend, or they were with a stranger. 70% of the people that were alone called out or went to help the woman after they believed that she had fallen and was perhaps injured. But when they were paired with a stranger, that plummeted to only 40% of those offering help. 2011 meta-analysis found that the bystander effect was more likely to occur, most likely to occur in non-dangerous situations, non-emergencies. In dangerous emergencies, we do find that people are very inclined to help out. But what's happening in those preceding moments is also kind of, or weeks or months, is also a cornerstone of Guardians for Health. So again, they were most likely to occur, the bystander effect was most likely to occur in non-dangerous situations, and it was less likely to occur with highly competent bystanders. If folks knew what to do, they were more likely to take action. Um, In the meantime, there have been multiple bystander intervention trainings that have been developed across the country to address a number of antisocial behaviors, and the evidence behind them continues to grow. Bystander interventions have been efficacious for addressing individual and community behavior change around violent behaviors such as dating violence, the Green Dot program, and sexual violence prevention, such as bringing in the bystander. So we received a multi-year CDC grant, which concluded last fall, to develop, implement, and evaluate Guardians for Health in partnership with 4-H shooting sports adult and youth. And this is the first time a bystander intervention, to our knowledge, has been applied to firearm injury prevention. To develop G4H, we did a number of semi-structured interviews we conducted them with 11 youth and 13 adults affiliated with 4-H shooting sports clubs around 9 states in about March to December of 2021. We did some deductive and inductive thematic qualitative analyses, and 6 overarching themes emerged. One is the tendency to view firearm injury as mostly unintentional. Secondly was the acknowledgement of a wide array of risks for firearm injury. Third was that there are a number of barriers to bystander action: lack of knowledge, lack of confidence, uncertainty around the consequences of taking action. Fourth, there were some facilitators identified, and in particular, the sense of civic responsibility motivates people to take action. Fifth, we found direct and indirect strategies could be useful for addressing potential firearm risk. And lastly, there was a belief that training in bystander intervention skills would be useful for those in 4-H shooting sports. The foundation of Guardians for Health rests on another psychological theory that's known as the theory of planned behavior, or TPB for short. This links beliefs to behavior by positing that there's 3 core constructs: attitudes, subjective norms, and perceived behavioral control, your sense of your ability to affect a change in a situation, together shape one's behavioral intent, one's likelihood of planning to intervene, and that then influences whether or not you will actually intervene. So in order to evaluate this, we needed to develop a measure that would apply this theory to firearm injury, and I will talk about that measure in a bit, but first let's take a look at the workshop itself. By late 2022, the G4H Bystander Intervention Workshop was developed and ready to implement. It was taught over Zoom by an interventionist at Brown University, a psychologist named Dr. Michelle Haykalis, and myself in 3 one-hour interactive sessions. Session 1 introduces youth to Guardians for Health. It ties bystander intervention to that core 4-H value of civic responsibility, and it interactively presents data on firearm injury prevalence. So addressing, for example, that point that came up during development where folks thought most of the injuries in the US, most of the fatalities from firearms were unintentional, when in fact we know that that's about 5% of total firearm deaths in the US. Session 2 introduces the bystander intervention arc shown here, and it identifies the risk for firearm injury and presents, or several risks for firearm injury, and presents tools to respond in the event a risk is present. We call those tools the 4 Ds: direct, delegate, distract, and diffuse. Various Ds have been used in various bystander intervention programs. This is our spin on the Ds. Session 3 addresses perceived barriers to action and ways to overcome them. All 3 sessions use interactive online scenarios to increase participant self-efficacy, their sense of perceived behavioral control, and their intention to use bystander intervention strategies so that there are not tragedies. And quiz games are also included to increase participant engagement. Youth participants ranged in age from 12 to 18 in our study. So this was funded as a Type 1 Hybrid Effectiveness Cluster Randomized Control Trial, or RCT. After developing the workshop itself, the work unfolded in the following 5 stages. We needed to recruit those clusters, those clubs around the country that would be willing to try this out. So we sent out letters and flyers. We did presentations to advisory boards for county shooting sports programs across the country. As the trial went on and we had some sites complete the study, we had some testimonials that we incorporated into those videos. And when someone leading a club was interested in trying out G4H, we would sit down and do essentially an eligibility screener to see whether or not they were an appropriate fit for the study. Then they would be randomized, and we had two layers to our randomization to figure out whether they were going to be in the control group or receive the workshop immediately. We randomized by rurality, and this was a self-reported measure. Would you say your club is located in a mostly rural area or not? And then we also randomized by the state's CAP law, the Child Access Prevention Law, whether or not that was present in their state. And then we had to move on once we had our sites, our clusters randomized. And by the way, those that were not put in immediate intervention, I refer to them here as the control group, but they were really more of a delayed intervention. We offered them the workshop after they were done serving as a control site for the study. In this third part here, family recruitment, we then worked over an 8-week period with the site leader on the ground for that club to enroll families over 8 weeks. And during that time, those families would complete a baseline survey. And then when we closed enrollment, the intervention group went ahead and completed the workshop in those 3 one-hour sessions. As I mentioned, we would deliver it remotely from Brown, and then we gave them short evaluation forms after each session, and those were additional data we collected. And besides the baseline survey and the follow-ups in the final box there. So after the workshop was completed, about 3 months later, we sent around a follow-up 3-month survey. And 3 months after that, we sent our final follow-up, a 6-month survey. So we wanted to see what was, being retained over time, and also measure whether there were any changes that we should notice in the control group. We also did some interviews with folks that received the workshop at the 6-month or after the 6-month time point. So a number of the kids that were in the intervention group and most of the site leaders, the folks on the ground that made that happen for their club. So this all went from mid-June 2022 until late 2024. So the analytic plan, at the time of the study start, we had a planned sample size of 50 sites, 50 clubs around the country. And our expectation was that in having 50 clubs, we would enroll about 2,000 youth. Latent growth modeling was planned to have co-equal TPB outcomes. However, this was COVID. And so due to the smaller than expected youth N, we revised the primary outcome before we completed data collection. And so we identified as our primary outcome behavioral intent. Do they plan to intervene in a situation we present them with? And then we had some secondary outcomes, which were knowledge about what firearm injury prevalence looks like in the US, as well as those early components of theory of planned behavior, norms, attitudes, and perceived behavioral control. And the analysis was linear mixed models with site-level random intercepts. We did complete case and multiple imputation with, of course, covariate adjustment. So who did we recruit? We did meet our goal of recruiting 50 clubs from around the country into the trial. They came from the 28 states shown here in green. Unfortunately, the two groups did differ in a couple of ways. The percent of clubs that self-identified as residing in a mostly rural area was a bit higher in the intervention group, but there was no difference in terms of the percentage of clubs that were based in a state with a child access prevention law or not. We had a good spread across the 4 census regions in the intervention group. It did turn out that about half of our control clubs were from the Western region. I'm not going to walk you through this whole flowchart, this consort diagram in detail, but I do want to point out that in the end, you can see the 2 bold boxes in the middle there. We enrolled 250 youth across the 26 intervention sites. and 174 youth across the 24 control sites. And I also want to note that those who withdrew, per the boxes right above those central bolded boxes on the slide, did not provide baseline data between consenting and then withdrawing. And I also want to mention the control group, oh, I said that already, was offered the intervention later after they were done with data collection. So baseline demographics on these folks, the mean age for the youth was about 14, and the youth participants were about 53% male. Race and gender, sorry, race is not shown here, but they were also about 83% white, and that is similar to the demographics across 4-H. The intervention group had a higher proportion of younger children, so ages 12 to 14 than the control group. So that's why I put a percentage there. 62% of the intervention group was in that younger range, and versus 48 in the control. And a lower percentage of parents who were college students were found in the intervention group. So we had surveys of the parents as well as the youth, for those parents, of course, that decided to enroll along with their youth in the study. And we found that 42% of the intervention parents were college graduates versus 63% of the control. And then if you look at the site leaders, these are the 4-H agents or volunteers in many cases who run that club on the ground. Those folks were less likely in the intervention group to be male than those that were in the control group, 19% versus 50%. This is a lot more numbers coming at you, but I'm just going to say to measure the 4 different constructs within the theory of planned behavior. So again, behavioral intention, norms, perceived behavioral control, and attitudes. I'll come back to knowledge in a minute. We worked with a TPB expert at UPenn to develop a series of 4-point Likert questions for each. And we repeated those questions for the 5 different types of firearm injury risk that we identified and walked people through in the workshop. And those were unintentional injury, suicide, mass shootings, intimate partner violence, and other assault. Each type of risk was portrayed using a little scenario, and then we would put a proposed intervention action that the reader could hypothetically take if they were in this scenario. And then we asked them a bunch of questions about how you would respond, what you would think, to get at those constructs for each of those 5 risks. The knowledge measure, the first construct under secondary outcomes, was composed of 8 questions that were mostly true or false, and we calculated the percent of questions answered correctly at the 3 different time points. So you can see here that those in the intervention group at 3 months were answered about 2 more questions on average, and also at 6 months than did their counterparts in the control group. The primary outcome of behavioral intention was significantly higher in the intervention group compared to control youth at 3 months in both complete case analysis and multiple imputation results. And again, unfortunately, I want to emphasize our smaller than anticipated sample size here. The effect did not hold at 6 months after the intervention. Among the secondary outcomes, I mentioned that the firearm knowledge score was notably higher at 3 months and 6 months for the intervention group. Again, both for complete case analysis and multiple imputations. Perceived behavioral control was also higher in the intervention arm in the complete case analysis at 3 months, but it wasn't in the multiple imputation results or either of these analyses at 6 months. No substantial differences were observed between the groups in norms, which, by the way, were a combination of descriptive and injunctive norms or in attitudes. Cluster level analyses that we completed showed the sites had a higher average, that those in the intervention group had a higher average in gun violence knowledge than the control sites at both 3 months and 6 months. And there were not other site level differences found for the other outcomes. Okay, so of the youth in the study, I'm going to talk a little bit about our evaluation findings and also our attendance. So 94% of those in the intervention group attended at least one workshop, and 86% attended all 3, so it was pretty good. From our session evaluations, we learned that session delivery had complete fidelity to the core workshop components, which was not surprising given that we switched from doing locally led delivery to remote delivery by us at Brown during the pandemic. And the evaluation completion rates ranged from about 76% to 100% across 5 response and scaled items, Likert scale items. Most of the youth and the club leaders gave high ratings to all sessions on all scales. The mean scores you can see for the youth are over 4 on a 5-point scale. And there were no significant differences according to individual or club level characteristics. So specifically with the youth here, we see that 73% rated all the sessions as somewhat or very interesting. The 85% of all of them rated all the sessions as somewhat or very informative. And then if we look at what we found with the club leaders, the site leaders on the ground, 72% of them rated all the sessions as somewhat or very well received by the youth. 75% said all the sessions were somewhat or very easy to deliver. And 84% were somewhat likely or very likely to tell someone about Guardians for Health as a resource. We also had a number of process implementation measures which demonstrated that the intervention was regarded by participants as both feasible in its delivery and acceptable in terms of content. The participant interviews that I mentioned earlier, we had 68% participants from 19 of the 28 states that had intervention sites in them. Almost all of the intervention site instructors participated in these interviews, and 44 of the 250 intervention youth participated. Chi-square analyses of this sample versus the overall study sample found that they were by and large similar. And the findings are more or less able to be grouped into 5 overarching themes. G4H expanded knowledge of firearm injury, of what firearm injury looks like in the US. It left people with the feeling that they now had learned how to identify risk of firearm injury and take action. They felt that it was valuable. They felt that it was enjoyable, especially the interactivity. The kids really loved using these Kahoot games that we had in there. And then, there were some external and internal barriers to scale up that we will need to address. For example, things around the pacing of the content or tech issues during delivery. So as does any study, we face some challenges and limitations. Although we achieved our target sample size at the cluster level for the number of 4-H study sites, the number of youth participants was smaller than a priori power calculation, resulting in revising our primary analytic outcome. Selection bias is possible and may have influenced the results in either direction. However, many studies experienced difficulty with in-person recruitment following the pandemic. And the study sample is limited to 4-H shooting sports participants, so that does limit its generalizability, which we're also addressing in the current iteration of G4H. And finally, although we used or adapted validated outcome measures, self-assessment is, of course, always subject to bias. So the relatively small and short-term effect on behavioral intention and the lack of impact on those related constructs, except maybe perceived behavioral control, may reflect that the youth and programs like 4-H shooting sports have strong baseline norms, attitudes, and behaviors regarding firearm safety already, and so they would need a more intense intervention to increase these theoretical drivers of behavior to take action in a situation where firearm risk is present. Exploratory analyses support this idea and finding greater effects among certain demographic groups. For example, younger youth and youth with non-veteran parents. Those groups may have less exposure to firearm safety training and therefore may be more developmentally open. And that's a conjecture that's widely accepted in other risk prevention literature. And again, this short-term finding may reflect that bystander intervention curriculum is going to need some boosters to maintain effect sizes. And again, that's a consideration for the work we're doing now. It can also reflect, of course, the low enrollment and the reduced power of the study. So that wraps up my explanation of the CDC clinical trial. So I am going to stop sharing my screen and pass the baton to my colleague, Katrina, to talk about what we have affectionately called G4H 2.0. So I'll just give her a minute there to get her screen share going.
Thank you, Mary. Okay. Okay, can everybody see a slide with some happy faces?
We can.
Good. Okay. All right. So I'm going to talk about our most recent endeavor, which is translating G4H for in-person delivery at 4-H clubs in Oregon State. So these two pictures are two of our close collaborators from this phase of the project. On the right is Erin Borla, the executive director and trustee of the Roundhouse Foundation, and Todd Williver, the 4-H shooting sports coordinator at Oregon State University, who you will hear from in a minute. So last year, these two reached out to us at Yale with interest in bringing G4H to Oregon and expanding the reach outside of 4-H shooting sports clubs to the wider 4-H community and eventually to other youth development organizations like Scouts and Future Farmers of America. Right now, we're about halfway through our planned year-long partnership and going strong. Oregon was a great participant in the G4H trial. This here is a screenshot from a CBS feature, How Students Are Being Trained in Gun Safety and Violence Prevention, that was aired on evening news last year. This segment, and you can look it up online too, reach out please if you'd like the link. The segment focused on how youth who are already familiar with firearms through shooting sports can play an active role in preventing firearm-related injuries and deaths among their peers. In the screenshot, you can see Oregon shooting sports youth taking part in G4H. So Oregon youth and 4-H shooting sports leadership are concerned about the youth suicide rate in Oregon. Oregon has the 12th highest suicide rate in the country, and suicide is the second cause of death for youth ages 5 through 24. That data is part of the motivation for our collaboration this year. But let's step back for a moment. The project in Oregon is part of a larger mission to scale up G4H across the country to youth populations that have regular firearm exposure. The goals and challenges for this stage of the process, which we call feasibility for scale up, you can see in the orange box, are different than our previous goals in different stages. So here we adapted the NIH translational framework called the STAGE model to help guide our work and think about it from a broader perspective. On the left is the initial feasibility and acceptability stage, where Mary spoke about the qualitative interviews that were done initially. We were clear from the very beginning that our goal was to achieve organizational ownership and eventually independence. We developed strong partnerships to facilitate trust and sustainability at multiple levels of leadership. So our goals for the initial step were to identify barriers and facilitators and try to create the best version of the intervention for the RCT. When we tested it, we did so under the auspices of a hybrid effectiveness implementation trial, which allowed us to continue to assess its real-world viability and dig deeper to understand for whom the intervention was most useful. Also during this stage, as Mary mentioned, we developed metrics to track outcomes for this novel intervention. Now we're working with Oregon to understand how G4H can serve 4-H and 4-H shooting sports clubs programmatic work. During this phase, in addition to pruning down and adapting some of the outcome measurements from the trial, we'll collect feasibility data to inform future scale-up. After this pilot, we will actively seek out other sites interested in scaling up G4H and continue to explore options with the leadership at 4-H shooting sports to integrate G4H into national committee recommendations and adding incentives to support the grassroots work. From the very beginning, our team worked closely with local leadership on common ground issues to develop content that was both true to bystander intervention approaches and that would also resonate with the shooting sports community. Over the years, our team has attended 4-H shooting sports competitions, national meetings. We visited shooting ranges and included leadership in academic conferences. During our visit to Arizona last year, Todd Kessner, at the University of Arizona Extension School and a 4-H director for Arizona, gave our team a Western Heritage demonstration at a local range. So while we transition the workshop from a virtual or hybrid delivery to an in-person delivery, we'll use a train-the-trainer model to enhance reach. We're thinking about fidelity. The Yale team is working very closely with our partners to ensure that the teacher's playbook reflects every proposed adaptation so that local instructors feel comfortable sticking to the written material. We're also including Oregon-specific statistics like the suicide rate that I mentioned earlier. We're working closely with shooting sports to ensure continued excellence in discussing firearms with 4-H youth, whether they are in shooting sports or not. As we identify core content and create modules adaptable to different populations, we're keeping our 4-H shooting sports leaders involved in all the big decisions, even when they don't reside in the local catchment area. For instance, we're creating interchangeable templates that will help tailor the material to youth with more or less direct gun safety knowledge. As I mentioned, we're also paring down the large battery of RCT assessments for ease of use in this and future scale-up endeavors. We're also creating new measures to track the feasibility of the train-the-trainer model, the in-person delivery, and understanding the organizational capacity and acceptability. So some of the specific contributions we've received from our partners in Oregon include editing content to speak more generally about gun safety for non-4-H shooting sports youth. For instance, avoiding more technical terms like muzzle. We've learned a lot from our partners about the level of gun safety knowledge of youth in Oregon. Our core content needed to be articulated into one strong take-home message. Together with our partners in Oregon, we re-centered the message, putting time and distance between a firearm and a person in crisis saves lives, and reinforced it with repetition and emphasis, the short version being time and distance. We replace slides and lecture with more engaging in-person activities that generate discussion. This slide here is part of an activity called Barrier Busters, where youth write barriers to intervening in a risky situation on sticky notes and then categorize them into broader themes on the board. The instructor leads a discussion about how to overcome these barriers. Some of the other barriers students have come up with in the past include fear of upsetting others, the difficulty of talking about tough subjects, not wanting to draw attention to yourself, fear for your own safety, and fear of making the situation worse or losing a friendship. We're also working on a potential booster add-on that might help sustain that knowledge improvement that Mary discussed even longer. All right, let's hear a bit about the partnership from Todd Welliver in Oregon in his own words.
I'm just wondering about the process of working, of the partnership that we've created with Yale and OSU and 4-H, and what the experience has been like for you.
Yeah. So several years ago, I had sort of thrown my hat in the ring to be one of the pilot states of the original G4H, what I think we now sort of call 1.0. And although I didn't get to know the curriculum very well, I had a couple of volunteers that really threw some effort into it and were firm believers in it. And from there, that was carried over to a couple of my teen ambassadors that went to the National Teen Institute in Idaho last year. And they came back with some very, very good information regarding G4H as well. So it was just sort of a normal progression as Roundhouse being here in my state and as we sort of talked about the possibilities to just jump all the way into this 2.0 revision. I've been delighted to be part of it. Working with you ladies has been fantastic. Being able to throw my 25 years of educator background into the process, and sort of knowing, I think, how to connect with my youth audience, and revising that curriculum to move beyond just the shooting sports facet of Oregon 4-H to a broader scope, including all of Oregon 4-H, and ultimately really any youth serving organization. I think it's just a terrific way to invest our time in a positive youth development sense. So working together, collaborating, different thoughts, the group process, it's been just a home run, just fantastic. I think for me, and I hope for you guys too. I hope I haven't bullied you into changes that I see as important, but rather made something that really has that meaningful impact, a take home message that really resonates with the kids, sticks with the kids. I think we all have those lessons in our lives that were so concise and so poignant and so perfectly timed that we remember them for a lifetime. And if we can do that with G4H, I think we can really move the needle.
That take home message, and he was right on with that take home message. That was such an important contribution to our curriculum. So Todd's not here today, but we're very grateful to him. And we have learned that research partnership can raise concerns for communities of firearm owners, undermining their feeling of autonomy, bringing up worries about coercion, lack of community benefit, misinterpretation of results, finding common ground on a shared purpose, like mental health and firearm safety, really helped us break down those barriers over time. And collaborating with 4-H shooting sports at different levels from early on helped the process unfold naturally. By the way, we'll be presenting on building partnerships between research institutions and the gun owning community at the Missouri Collaborative on Firearm Research on June 18th from 1 to 2. You are all invited. The presentation is open to the public, so please follow up with Mary or Carrie or I if you are interested in attending that. We can get you the link. And a final concluding thoughts on G4H as a whole. Our team is very proud of having developed and tested the first ever bystander intervention, and the behavioral metrics to go with it based on the theory of planned behavior. And now are hoping that the Oregon regional adaptation serves as a blueprint for further expansion. We hope to scale further in the next year or so. We're actively seeking youth development clubs interested in incorporating G4H into their curriculum. So please help us spread the word and get in touch. And another shout out to our collaborators, of which there are many. And I will give a special shout out to Craven from Georgia and Russell from California, who are both here today. Thanks for joining us, guys.
Awesome. Thank you. Do we have questions or comments? And again, thank you, Craven and Russell, for joining. Any questions or comments from Mary or Katrina? Or Mary and Katrina, is there anything that you wanted to say that you didn't get a chance to say in your time?
No, but I don't want to put my colleagues in California and Georgia on the spot. But Craven, if there's anything that you want to share that we didn't adequately deliver on in this presentation, please feel free to chime in.
I would just say kudos to the group at Brown. It was challenging doing this remotely. In our shooting sports clubs, they meet at ranges, they meet at places that don't have good connectivity, and just the dedication of the group there to just keep plugging and keeps, log back in, do all these things. We could not have done it without them, and they were just so wonderful. So thank you for all the effort that you put into sharing with our folks.
Couldn't have done it without you.
I'd actually echo that as well, just knowing the nature of 4-H shooting sports and where those project meetings are held at and the access to them. We don't often have great access to the internet, and having you all pushing back in and reaching back out to the agents, really to help out and support the program. There's just been a lot of great follow up on this, and I can echo the statements also from our volunteers who implemented the program, that they still continue to talk about it. They ask about it. This is like sort of the next level where 4-H shooting sports steps in. Yes, we talk about shooting sports, but our goal is developing young people. And that's the big goal here. So shooting sports just happens to be a manner in which we do that. We do that through animal science and STEM and all the other areas. Our goal isn't to create competitors, things like that. That just happens. So this was a great opportunity for us to work together with a team really dedicated in reducing gun violence and dealing with those issues. Thank you, team.
Thank you, Russell.
Thank you.
Yeah, I was a 4-H kid, and I can confirm we met in like the wing of the First Baptist Church that was all cinder block. So cell and internet signals we're not getting in for sure. I'm wondering, we don't all often see what's super interesting about this project. I mean, there are a lot of things, but just from like a kind of academic-y perspective, we don't often get to see sort of the RCT and then watch it get translated into implementation and figuring out how to tweak that curriculum to be usable. But of course, that's the goal of all the RCTs we do and all of the studies that we do, RCT or otherwise, is to take whatever we learn and make it usable. So I'm wondering, now that you've gotten to see sort of both ends of this, if there's something you would do differently in the RCT setup to think about make it usable. Like, is there something that you learned along the way where someone from Oregon said, or Missouri or wherever has said, what about this? And you wish you had asked it in the RCT, right? So we don't normally get to go back in time, but for those of us that are designing studies now, thinking we would like to borrow on your hindsight. If you have it, maybe you did it perfectly. And that could be Katrina, Mary, Craven, or Russell. That can really be sort of anybody. Just look, with the caveat that hindsight is 2020.
Yes. Thank you for the question, Carrie. I would say we certainly did not do the study perfectly. There were things learned along the way that were helpful. For example, that we were able to kind of steer ourselves in a little bit of a different direction. We learned early on that it wasn't enough to do an eligibility screener for the site leader, but that site leader really needed to have a sit-down chat with their club about what this is and do they want to do it. Before the site leader enrolled the club, because we did have a lot of dropouts after the club leader was all on board, and then they went to their families and they were like, what's this? And so that was something that we were then able to incorporate and say, okay, I'm psyched that you're psyched. Can I, zoom in and talk to your families? Can you talk to your families about A, B, C, and D? Can you save some days in your calendar in the case that you're the intervention group where people are going to be available to do this? So that was more learned along the way than at the very end of the study. Another constant challenge was the tech issues that have already been mentioned, but we learned that we had these big packets boxes that we sent people with different swag and prizes for the games that we were playing. And we learned that we had to include printouts of the slides that were the bulk of the presentation for each session, just in case someone hadn't downloaded it to their laptop and they weren't able to get on a hotspot or certainly Wi-Fi where they were showing this to their clubs. And kids had to borrow cell phones from their parents if, they weren't able to get a signal. And so those are things that we still need to think about in this go round. A lot of places did teach the curriculum at their extension office. And so that meant they were meeting in a different location than they normally had shooting sports. And that had pluses and minuses. In some cases, the kids were really competitive and they didn't want to lose the shooting sports time. What do you mean we're not going to the range today? In other cases, they were able to book a different day of the week. So it didn't come out of the shooting sports time. But then the parents were like, but I got to take, their younger sibling to football. And so scheduling feels like it was 50% of my work for 4 years. But these I think are also things that vary by club. And so we need to build in that flexibility as well and say, okay, here's what we're trying to go for. If you need to, take A, B, or C route to get there, that's okay. And also specify the times where it's not. Like, we need to show you to show these slides. We need you to play this, be somewhere you can play this game. So just kind of making, our communication as we train the trainers to make sure that all those bases are covered and that it's also flexible enough to still be doable for the clubs.
Yeah, and I'll just emphasize that first point, that Mary made, which I think applies to other projects in similar situations, which is pairing the sort of grassroots work, the building the trust every day with the local leaders, together with sort of the policy decision makers. And I think for us, we've had some really interesting conversations with 4-H shooting sports leadership at the highest level, at the national committee level, about how this project may have potential for being integrated into curriculum. And right now they're still ongoing, but I think just like sort of having that strategy of the double of addressing the institution at multiple levels is really important from the beginning.
Russell, I saw that you had come off mute. Did you want to add something?
Yeah, it's exactly what Katrina and Mary both said. It's this actually leads into across the board those grassroots efforts to bring in the individuals that you're working with. If you're going to be addressing issues that they've got that they have within a community, they've got to be a part of that conversation. And California 4-H was identified recently, the shooting sports program, as a strategy in reducing gun violence in California's public health roadmap for violence reduction. So that's publicly released information now. And my colleague and I went to a program area where they were asking us about, like, we're not public health people, although I think we are now. We can really talk about that as a strategy. But Nate and I, my colleague, had really talked about like a lot of their efforts were coming to the community, the firearms community, and saying, here's what you need to do. And instead of engaging in that conversation back and forth and listening and having those conversations that felt like imposed upon. And I think Mary and Katrina, but you all did a great job at having those conversations and things that we learned about. Honestly, and that's important for any kind of work you're going to be doing. Yeah.
Yes, welcome to the public health team. Other questions or comments? Anybody who hasn't had a chance? Okay. Well, I don't want to keep us over our time. So I will give you 5 minutes back in your day, and hopefully that will help you. Thank you to Katrina, to Mary, to all of the Guardians for Health team, Craven and Russell, for joining, and of course, all of those names on that slide that were put up earlier. We understand this is very much a team effort. So thank you for that, and we look forward to seeing how this progresses as you move forward with implementation in Oregon and other sites. So keep us posted. Thank you.
Thanks for having us.
Thank
All
you.
right, everyone. We'll see you in June for Margaret Kelly's A Gun of Her Own. And I hope everyone has a great day. Thank you.
Thank you.